Hello and welcome to DisruptX, a brand new virtual talk series conceptualized by Miss Sonica. DisruptX is going to bring to you inspiring and insightful conversations on how technology is transforming industries and the business landscape, enriching communities, and driving human connections. How technology is revolutionizing every industry, from retail, real estate, food, to agriculture, education, energy, and much more. Today, we are here to discuss how technology is reshaping the healthcare industry, an industry which has witnessed significant and massive shifts over the past 22 months, especially with regard to implementation of technology for better and more improved healthcare delivery. But before we get into the conversation, let's take a quick look at some data emerging from the healthcare space. So we see that digitalization in the healthcare industry has seen a dramatic rise from 5% in 2019 to 44% in 2021. In terms of overall tech spend, some areas that stand out are artificial intelligence, big data, blockchain, and robotics, among others. Let's turn to investments now. A record $51.3 billion have been invested in global health tech this year, up to 80% on 2016 levels. Unsurprisingly, for investors, health tech remain a very hot area. As such, we are also seeing that 2021 continues to be a blockbuster year for digital health funding, an area that has seen investments worth $21.3 billion across 541 deals. Among areas that are of massive focus for investors are mental health, that has raised $3.1 billion, and women's health, that has seen one of its best years in 2021 in terms of investments, totaling $1.3 billion so far. These are numbers. Now for the ground realities, we have a stellar panel of speakers with us, representing various segments from the health space. Allow me to welcome our speakers for the day, starting with Khawla Hammad, founder and CEO of Takalam, a UAE-based counseling platform for mental well-being. Dr. Manvir Singh, COO, Thumbay University Hospital, one of the largest private academic and state-of-the-art healthcare destinations in the Middle East region. And Sophie Smith, founder and CEO of Nabta Health, that offers personalized healthcare for women through its novel and hybrid model. Sophie is joining us all the way from the UK. On that note, a very warm welcome to our speakers. And now to those who are watching this episode. We really want you to be part of the dialogue as well. So please share your feedback, your thoughts on our LinkedIn page. The handle is @DisruptX. And don't forget to use the hashtag @FutureOfHealthTech. Now, without further ado, let me jump into our conversation and understand how technology is transforming the healthcare space and the businesses and the people we have here today. Allow me to start with you, Sophie. In 2020 and 2021, if you could please tell us what kind of investments you've made in Nabta Health to sort of significantly transform the women's health space, a space which has only drawn 4%, less than 4% of investments that go into the life sciences space. So if you could share your inputs and how you are sort of helping this space to emerge much stronger.
So increasing the amount of traction and interest in the femtech market in the MENA region, and specifically for emerging markets, is actually my number one personal objective for this year. I think if you look at femtech globally, it's estimated to be worth $1.186 trillion by 2027. And of that, the largest segment is chronic diseases at $218 billion. But fewer than 1% of femtech companies focus on this space, on chronic disease. And of those, fewer than 1% focus on emerging markets. So I think what we're trying to do is target a growing segment here. Chronic disease, the prevalence of chronic disease is expected to increase by 100% in Africa, by 86% in the GCC, and with similar stats across MENA in the next 5 to 10 years. And so we're trying to put focus on a critical area of health for women that currently isn't attracting a lot of interest and also a lot of investment. Indeed, if you look at the investment landscape in the MENA region this year, 0.9% of venture capital has gone to female-founded companies, of a total of over $2 billion, and precisely 0% of that has gone to femtech companies. So although we are starting to see more femtech companies spring up in the region, and that's only happened maybe in the last 12 months, mostly focused on period care. There's Lizom, which is an eco-friendly period care platform in the UAE. There is My Lily Box, Pective, a couple of other examples. Delicare, which was set up as a home testing company for women here. We're still lagging behind the US and Europe in terms of interest and investment in the space. So for us at Nabta, we enable the accelerated detection, diagnosis, and treatment of chronic diseases in women in emerging markets. Our R&D is headquartered in the UAE, and we're trying to do as much as possible to make a noise about the opportunity that is femtech in emerging markets, and also speak to as many investors as possible about why this is a very attractive space.
Absolutely, and very important as well. Moving over to you, Khawla. As per statistics revealed, around 17.7% of the Arab world today suffers from some form of mental health disorder. And that's not even touching the tip of the iceberg, because this is an area that is not much spoken about. So obviously people do not reach out for help. Given this situation, through Takalam and by leveraging pieces of technology, how are you opening up conversations around mental health?
Thank you. Thank you very much for having me. First of all, it's a pleasure. I mean, like you said, looking at the numbers in the region, and this is a global issue, but in the region in specific, it's very, very alarming. And it's one of the things that have been neglected for a very long time. It's like the big elephant in the room. Nobody wants to talk about mental health. It's sort of a taboo. There is a lot of judgment, a lot of negative perception when we talk about mental health. And this is because of the misunderstanding. Basically, when you say mental health or someone needs mental health support, you directly go into the extreme aspect of the spectrum and thinks this person is, you know, either needs psychiatric help or what they call, I don't like to use the word crazy, but this is what unfortunately is our reality today. So a lot of guidance and a lot of awareness and education has been happening, fortunately, to create this awareness around mental health and recognize that everyone of us go through daily doses of mental health challenges. You don't necessarily have to be mentally ill to seek mental health support. You can be just a regular person like me and you who is going through something as simple as stress. burnout, and now, especially with the pandemic, it has been highlighted more of an issue. And according to the World Health Organization, mental health is going to be our next pandemic, which is very, very serious to look into and try to mitigate the risks and the issues arising as much as possible ahead of time. So being virtual and being available online tackles a lot of elements and aspects to it. And that includes the privacy aspect, which will help with the stigma, making it as approachable as possible, staying away from the whole clinical look and feel and clinical approaches is key to attract individuals, to help them take that first step towards their mental well-being.
Absolutely, and I couldn't agree with you more. The importance of opening up conversations, being able to go out and seek help is so crucial today. And as you rightly pointed out, it was even before the pandemic that the World Health Organization actually said that mental health will become the next biggest disease, which we really need to prevent.
Correct.
Thank you so much, Khawla. Moving over to you, Dr. Walia. Almost overnight, we moved on to digital platforms and teleconsulting when it comes to hospital and hospital management. I don't know how many teleconsults I must have done in 2020 and continue to do so, although the numbers have declined right now. People are going into the spaces. But when that happened, when that almost overnight change happened, how did you leverage technology to make the systems efficient, to take informed decisions about patient care journey, especially at a time when research shows that almost over 80 megabytes of data is being generated by patients annually, single patients, that is.
Thank you for having me for Disrupt. So
it's a pleasure, sir.
Thumbay University Hospital is a part of Thumbay Group, which is based in UAE, and it's a diversified international conglomerate with around 20 different sectors. So as far as the tech investments are concerned, so first of all, our focus is to give seamless healthcare delivery to our patients. And we are doing this not because of pandemic, pre-pandemic also, we were very much into it. Since we have our own homegrown IT system, so we don't have to worry about the source codes and things like that. So we created our own EMR systems way back, around 10 to 12 years back. So we started with baby steps, and we initially had basically our OP encounters basically fully digitalized, followed by IP encounters now fully digitalized, and even ER is fully digitalized. Similarly, we worked on picture archiving and communication systems. That was also around 7 to 8 years back or 9 years back. And our target, we had two targets. One is to basically make the hospital filmless, and second was to basically digitalize the radiology systems, especially the X-rays, the CTs, and MRIs. And that we did. And that helped us to basically digitally push the images, not only to the radiologists for their basically diagnosis and reporting, but also to the clinicians. So this is as far as first part is concerned. And then, what happened is that when we started our journey, we wanted to basically get the accreditation, and we wanted to get JCIA, which is basically international accreditation for the hospitals. So when we started that journey, so in that, quality was an important part, and quality had patient safety, which was a very important component. So in that component, one aspect was basically prescriptions and prescription errors. So what we did was basically, now prescription errors are of three types. One is at the level of the doctor. Second is at the level of the transcription, that is transcribing errors, prescription errors, transcribing errors, and dispensing errors. So way back in 2012 and 13, we targeted the prescription errors by creating e-prescription system through our Thumbay technologies, which is in the forefront of basically helping us to get the things done. And then what we did was, second thing was, because of e-prescriptions, what happened was that the transcribing errors came down as the prescription was basically digitalized. Now, The prescription errors, basically we introduced a software which was basically IBM Meribix. So with that help, what happened was that whatever drug to drug interactions and things like that came under control. And the third part is basically dispensing errors. So in the new hospital where we have, so this is basically a most modern hospital that is available in the Northern Emirates. And we have dedicated in this hospital around 100 beds for long-term care also. Now, in this hospital, we have introduced robotic pharmacies, so which helps us to basically control the dispensing errors also. So this is how basically we improve a patient's journey, and we have started digitalization, the process of digitalization, not now, but from a long time back. And then for blood transport system, we have something called pneumatic systems. So when the blood is drawn, before the blood is drawn for the patient, what happens is that once the nurse basically calls the patient, checks on the identification of the patient, then the barcode is generated, which is put on the vacutainer, and then the blood is drawn. So that reduces the errors, and then it is sent through the pneumatic system to the lab. So within minutes, it reaches the lab, and so there is no human interaction with that. We don't have to wait for a human to basically transport the blood to the lab. So this is what we do. Then another system that we introduced over here in this hospital is basically queue management system. Now, this was introduced before pandemic, but in pandemic, it really helped us a lot because it helped us to maintain the social distances. There was no overcrowding. There was no queuing up at the reception for the patients. So they had to just take their tokens and sit down. So this is how we managed our queue systems and digitalized that process. As far as teleconsultation is concerned, we had really used this. And when we created this model, we had to create this model complying with the standards which were laid by MOH and getting the due approval of Ministry of Health. With this, we used this model in the pandemic for chronic patients, our own chronic patients, so that they should not come to the hospital because they were the vulnerable patients. And we use this for COVID patients also, because once they get discharged from the hospital, so instead of coming time and again to the hospital, so they were basically given teleconsults. So this was as far as this is concerned. And the other part is that our as far as at 80 megabytes is concerned, so basically what happens is that our records today are fully electronic and digitalized. So our doctors look into those records, and especially when there is a chronic diseases are there, and especially when we look into the other ailments. Suppose, let us say a female comes for basically when she's on a family where she have to come for the regular follow-ups. So everything is digitalized. So for it is very useful for the doctors to look into those records, whether it's labs, whether it's radiology, whether it's their clinical notes, and compare them to the past and to come to the. So all these things basically helps us in this way. And the previous data acts as a good source.
It's really amazing. What you've given me is sort of total end-to-end management of various functions in the hospital with the use of technology. But I have to admit, Dr. Walia, the coolest that I find is the robotic pharmacy. And I'm sure.
Thank you so much.
And I'm sure many people would have told you this.
Yeah.
That's
and
really
it was
cool.
implemented before pandemic.
How amazing. So we see that we are actually living in a world where technology is enabling the healthcare sector and regulating it in a manner never seen before. And on that note, we will now move on to our next segment, which is the rise of hybrid healthcare models. Here too, I'm going to start with some data related to mental health. Cases of anxiety and depression around the world increased dramatically in 2020, with an estimated 76 million extra cases of anxiety and 53 million cases of major depressive disorders. Nothing short of a crisis, I would say. And unfortunately, as Khawla rightly pointed out, there's a lot of stigma around mental health, preventing open conversations. I move on to you, Khawla. If you could please tell us how Takalam is making a difference in this field, and if you could point out how your tech-enabled AI and ML-powered model is helping more people to not only open up and speak up, but also get access to quicker diagnosis.
Right. So with Takalam, the objective was to help individuals from anywhere to access mental health care easier. The lack of access has been there because of many things. One of them, like we highlighted, is the stigma. Going in and out of a clinic makes people uncomfortable. So having a solution from the comfort of their home is key. And other limitations were including logistical limitations, including affordability is a big aspect to it as well. So with Takalam, we wanted to create an easy and simple platform to empower individuals as well as entities who are looking to enhance employees' well-being and increase productivity levels, to access a highly selected, a highly qualified group of experts through Takalam's platform with full privacy, and even to help overcome the stigma aspect, we allow the user to go completely anonymous. And this is basically through several ways of communication that is used according to their preference, that is in the form of audio call, video call, or even just messages. So with Takalam, we have been trying to and working on daily basis on making this easy as possible and simple as possible for someone who needs immediate help or who needs to start somewhere and lack even the guidance by starting. Because a lot of time you would identify or you'd say, yes, I do need support, but I don't know where to start from. So we have implemented a matching process that would guide the user throughout the whole journey step by step, starting by understanding where they at and understanding the needs, and based on their symptoms, their patterns that they have been going through, we will be identifying and help them match with the right expert that would answer to their needs. And so this is what we have, and it's been, it's been an amazing to see the need for it and the increase even with the employers, because when you go talk to businesses nowadays, there is obviously things that are out of control, that employees go through, the burnout, stresses. How can they manage all of that? Because at the end of the day, it affects productivity levels, it affects retention rates. So how can we tackle things that end up being shown in physical illnesses, and chronic diseases also is a big part of it, because it can lead to mental health challenges and vice versa. So reducing medical costs as well. So we work closely with employers, and this is another way for us to tackle the affordability aspect, because insurance still, this is not one of the things that would be funded by insurance or covered by insurance. So having employers and businesses incentivize this to their employees directly will help us get to the biggest number of individuals that we can help on a bigger scale. Now, when we look at how technology can help and making this whole journey as efficient and as effective as possible, whether it's for the user or for even the practitioner, the counselors, because the traditional way that it has been done, there is a lot of paperwork, a lot of processes, a lot of details and understanding that needs to happen prior to the session. Automating these steps, whether it's an assessment that happens before the session, an assessment that happens after the session, because at the end of the day, you want to come up with the right treatment plan for each individual and to be able to track progress. This is where technology, AI, and ML applies into this aspect, identifying more effective diagnostic, identifying more effective treatment plans, and even in these simple steps of just identifying the right counselor to match with the right individual according to their needs can also be utilized in the sense of AI. Now, if we look at there is another issue is the lack of providers, and this is a global issue. And here where you can integrate for simple cases that don't actually require to see a therapist, they would require just simple guidance from a source that is validated and that is trusted. So this is where chatbots come into place, identifying key behaviors, key elements that would support those with very, very simple needs and help with the triage also before sessions is key into this game.
Wow, that's really very, very interesting. But one thing that I would like to ask you is how have you sort of improved the level of accuracy of your matchmaking process between somebody seeking advice and your counselors?
So this is a great question. As we have just started, implementing such a solution, this is an ongoing process. The more data we get into identifying the patterns, identifying the needs, and the more exercise that we go, the more of going through the exercise of doing the matching process will help us get to that level, and we should start somewhere. And then you have another thing here is the Arabic element to it. So when you look at Arabic data sets and Arabic AI solutions, these do not exist. And this is another thing, because we are providing the solution to the Arab community globally, and the whole community as a diversified community we have in our part of the world, there is a lot of customization, there is a lot of personalizations that need to happen. So the more input we get from the end user, the faster we train the machine to give us more accurate results and accurate matching solutions.
Amazing. Thank you so much, Khawla. Moving over to you, Sophie. Nabta is also a first-of-its-kind MENA-based healthcare company to use a combination of digital technologies to create innovative, personalized care pathways for women. If you could please tell us a little bit more about your AI-powered hybrid model that helps women to manage their health much better, typically a segment that has been underserved.
Yes, certainly. And I'm grinning because we actually conceptualized the hybrid healthcare model and coined the term back in 2018. So actually a couple of years before COVID hit. And we have a book on hybrid healthcare with Springer that is coming out early next year that talks about the hybridization of care from different, in terms of different areas of care. So looking at maternal care, other aspects of primary care, etc., and then looking at the technologies that are being used to enable this transition. In terms of Nabta, we actually spent 15 months in the discovery phase of R&D before coming up with our hybrid healthcare model. And the reason we settled on a hybrid model of care was that we acknowledged that while there were very interesting things happening in the femtech space, lots of sort of period and cycle tracking apps popping up in the US, and it was still relatively early days then, they would tend to give women insights in isolation without actually connecting them to care providers in order to solve the problems that these insights highlighted. So we thought, rather than focusing on a particular delivery mechanism, such as a specific medical device or a test or even a consultation, we would instead focus on reimagining the things that doctors use today, clinical pathways, to get patients from symptom to diagnosis, diagnosis to treatment, treatment to rehabilitation. And we focus specifically on the first part of that clinical pathway. So how do you get women from symptom to diagnosis? And we do this in using three things, again, that doctors use: triaging, monitoring, and testing, and in a very specific way. So initially we're focused on conditions chronic diseases that impact female fertility. The first of those is polycystic ovary syndrome, a hormonal imbalance that is implicated in roughly 70% of female infertility. And we've looked at the way that doctors diagnose PCOS today. So focusing on the identification of 2 out of 3 symptoms: anovulatory or irregular cycles, elevated levels of testosterone or other male hormones, androgens, and then polycystic ovaries. And we worked out how, using an AI-powered pathway and the integration of various devices and tests, we can optimize this process as much as possible. And our clinical pathway today, which involves the integration of one medical device and one home test, and then a kind of a confirmation via consultation by a doctor, means that we can diagnose women in 90 days and a single doctor visit versus the global average, which is 2.5 years and 3 doctor visits.
I was going to ask you this. How have you optimized the period of diagnosis? Because that is one of the biggest obstacle before you actually get to the treatment level. And reducing it to 90 days is saying something.
Yeah, and 70% of PCOS is actually missed or undiagnosed globally. The reason for this is that, I think, go back a couple of years, it was almost universal still to think about diagnosis and treatment in the context of traditional healthcare. And actually, there are a lot of things today that allow more patient-centric care, patient-led care from home, that greatly assist with particularly that first part of the pathway, symptom to diagnosis. So, for example, with PCOS, the way that doctors would traditionally diagnose a woman with PCOS is to start by giving her an ultrasound and looking for cysts on her ovaries. But polycystic ovaries have, these little follicular cysts that go all the way around the ovary. They look like a sort of string of pearls. They're not the same thing as ovarian cysts, and there are many different types of ovarian cysts. And generally, you need to have sort of 12 plus on a single ovary to be diagnosed with PCOS. And what was happening, or what happens still today, is that a lot of doctors will see some cysts on a woman's ovary and go, oh, you've got PCOS. And actually, even if she had the correct number of cysts, that wouldn't be sufficient for a diagnosis. The doctor would need to test her to make sure that her testosterone levels were elevated. They'd need to do a differential diagnosis to rule out things like hypothyroidism or hyperprolactinemia. And ideally, they need to understand whether she is actually ovulating or not. And this final thing is very difficult to do from a doctor's office. The only way that you can accurately confirm whether a woman has ovulated or not is to have her come in every couple of days, watch the follicles mature until a point where basically they disappear and the egg has been released. Whereas, for us, we start with confirming anovulatory cycles. We have a vaginal fertility monitor that's integrated with the platform that detects ovulation with 99% accuracy in cycle. And that applies to women with irregular cycles, with hormonal imbalances. So there's a much greater degree of accuracy with this device than there would be with a home ovulation test kit, for example. So I think if you factor in hybrid, if you hybridize the process, if you factor in these digital technology options, you give yourself a lot more wiggle room. You allow yourself to do a lot more things in a kind of an ongoing and a real-time way that you wouldn't be able to do out of a doctor's office. So that's how, by taking a hybrid approach to clinical pathway delivery, you can very materially and rapidly improve health outcomes.
Thank you so much, Sophie. And I move over to you, Dr. Walia. You've already mentioned how data, algorithm, deep learning, and so many other tech pieces have actually helped your business, have transformed your business. But I've always been very interested to understand the future of a largely untapped market, and that is of the wearables and hearables, particularly for older adults, in detecting and monitoring chronic diseases and taking prompt action. Where do you see this segment going? Do you use any of these wearables and hearables in your at the Thumbay University hospitals?
Yes, we use them, especially VRs. We use them in a physical rehab center. We have got a physical rehab hospital So which is again a state-of-the-art hospital, which has got basically hydrotherapy, and they've got the Google cycles and things like that, and human XR. So VRs we use is one of the VRs that we use in physical rehab hospital is in the form of Google cycle, which is basically meant for dementia and for knee rehab. So what happens is in dementia, what we do in the Google cycle is that the patient basically there is a static cycle. In front of the static cycle, there is basically an oval screen. And there's a laptop connected to it on one side. So what happens is a physiotherapist puts up, let us say a patient is from Aljar, Ajman, and let us say a street number X. So what they will put is they'll put that over there, the address over there. And the person who is having dementia, they'll start cycling. And when he starts cycling, he will see the landmarks moving towards that area. So the Google cycle will guide to that particular address. So what happens, this helps, especially in the patients of dementia, to basically start memorizing or start remembering, yeah, this is my location, this is where I was, and things like that. So this is what happens as far as VR is concerned, as far as in the physical rehab hospital. Similarly, we have got human XR, which is for basically hand movements and leg movements, and this is for the active assisted exercises of the patients. So this helps them to basically do the active assisted exercises. Third thing, very important and very interesting thing we have in our physical rehab hospital, that's a car simulation. Now, this is again for geriatric patients, for patients having phobia of driving, dementia, and patients who have got basically limitations in upper and lower movement of the limbs. Now, this is basically a simulation where we have got three screens, one on the right, one on the left, one in the center. And then we have got a complete setup of basically like a car. So we have a car wheel, which the patient can drive, and then we have got an accelerator, we have got a brake, and when he looks forward, he can look at basically the car that is moving forward or backward. So with the help of this, what happens is the patients who have got phobia for driving, that phobia goes off, and patients who are basically who have got limited movement disabilities. So this helps in correcting that also. So this is what we use basically as far as the simulations and variables are concerned. And as far as another interesting thing is, as far as AI is concerned, so we have got something known as virtual patient learning system, and this is for the students, for the medical students. So what happens in this system is, now this system was basically created by our own university, Gulf Medical University over here. And this is the first kind of its application in the region that exposes the students, whether they're basically medical students or whether they're pharmacy students, to 60 different patient problems involving males, females, age, and different ethnicity. So just to give you an example, let us say there is a patient who, this is basically a virtual patient. This is not a real patient, this is a virtual patient. And the virtual patient, they have got the problems that are already basically fixed into that. So the virtual patient will come and say, will give a history that he'll say that, okay, an example, this is just an example, that I have got a vague colicky pain in the periumbilical region, and that pain has now shifted to the right quadrant, lower quadrant. And I have got doctor anorexia, so I cannot eat, and there is a vomiting, I feel like to vomit. And so this is the history that is given. Now, again, as per chat box, the basically virtual patient will ask a question that what you want next. Then the student basically has to basically click over there that I want this. So suppose he says that I want science. So he will give the science, the virtual patient will give the science that, okay, I've got low grade fever. And when I move my hip in a passive way, especially on the right side, so I develop pain. So this is a sort of basically symptoms the patient will give.
Okay.
So based on that, then it will prompt that, okay, what next? What you want from me? Then the student can ask like, okay, can you give me the labs? So it will give the labs. The virtual patient will give the labs. Okay, I have got basically my mild leukocytosis with accounts between 12 to 18,000 and things like that. And there's a what next? Then the student can ask, okay, give me the radiological findings. So they will give what sort of radiological findings do you want? Do you want X-ray, or you want ultrasound, you want CT? So that in the chat box, okay, I want CT findings. So they will give the CT findings. And based on that, now the virtual patient will say, okay, doctor, what do you think is my diagnosis? So the student will give the diagnosis and they say, okay, what is my differential diagnosis? So they'll give the differential diagnosis. Suppose if this is my diagnosis, what next? Suppose now with all these signs and symptoms, the diagnosis comes to be basically acute appendicitis. So what next? So he said that you have to be prepared for the operation. And then all these things, this is how the things happen. So what happens with this? Two things happen. One is because the patient is virtual. So the communication skills of the students, they improve, their analytical thinking improves. So this is how basically we try to apply VR, we try to apply AI in our systems over here.
Sounds fantastic. Thank you so much. So, of course, undeniably, 2020 and 2021 have been big years in terms of tech implementation in the healthcare space, but it does not come without challenges. There are various challenges and barriers to tech implementation in the healthcare sector. It could be personal preparedness, it could be funding, it could be various other things. And I shall start the segment with some data on women's health. So last year, even as investment in health tech in the region grew by 280% to touch $72 million, none was directed towards femtech. And with that, allow me to start with you, Sophie. Do you see funding as one of the barriers to tech implementation for Nabta? And what are you doing about it to mitigate this challenge, to overcome this challenge? What is your plan over the next 12 to 18 months?
So it's an excellent question. And I apologize, I'm being joined by a small representative.
How wonderful. He just cheered me up greatly.
Yeah, this is William. So how are we solving the issue of funding? It's a really good question, and it's one that we get asked a lot. We did our initial seed round, which we raised when we ended the pre-commercial or the discovery phase of R&D, excuse you, and moved into the pre-commercialization phase. We raised a seed round of $500,000, all with angel investors. And our angel investors have been amazing for us because they've opened a lot of doors. So then when we got ready to commercialize the platform earlier this year, and we moved to open a seed plus, although we did initially reach out to a lot of venture capital funds, the conclusion we quite quickly came to was that we were very unlikely to secure VC funding from the region. A lot of the questions you asked were, hybrid healthcare is a really interesting model, but why are you only focusing on women? And I think with this question, it was what they're trying to say is it's clearly got principles that are applicable to men and women, and we highlighted the gaps and the opportunity, but that was a big obstacle for us. We, as you can see, William is my third child that I've had since founding Nabta, and I raised and closed our seed round just after I had my second. Have raised now half of this round since I've had my third. And I think being a female founder with a young family can be a bit of a compounding problem or disadvantage when you're trying to go out to a predominantly male investor community and raise money. So we did a couple of things. We decided to focus our Seed Plus also pretty much exclusively on angel investors. And we've closed now over half of the round with angel investors. We also decided to take action and start what we call the 2022 Female Angels Movement to identify 2022 female angel investors for emerging markets by the end of 2022. And we now have a steering committee of 30 people, evenly split, 15 men, 15 women, who, with an official launch targeted for January, who are now actively working to increase the amount of female-friendly capital in the region, because we acknowledge that it's a fact that investors in general will invest in things that they think are cool. And if you're not a woman who's experienced women's health issues, you're unlikely to think that femtech is as cool as it is. So the more female investors and the more female-friendly capital that there can be in the region, the better it will be for us, the better it will be for other femtech companies in the future.
I couldn't agree more. So you do see a certain amount of shift in mindset, don't you? In the region, of course.
Yeah, I think there's been a shift in mindset for a while. I think there's a real appetite to be both supporting female-founded companies and to be supporting companies that are female-oriented. So specifically building things that are there to benefit women, like femtech companies. But I think that there's still a lot of unconscious bias in the system that makes it difficult for people, despite their best intentions, to actively invest money, whether it's that, and it's been proven statistically, in general, we tend to judge women based on their performance instead of on their potential. So especially at the pre-seed and seed stages, it's a lot harder for women who are, looking at kind of projections and talking about non-revenue based traction to secure funding than it is their male counterparts. So I think, there are a lot of things in the system that at the moment are barriers to female founded and female oriented companies securing capital. And we're trying with the 2022 Female Angels movement to address one of those.
Wonderful. Thank you so much, Sophie. Moving over to you, Dr. Walia, what are some of the barriers to tech implementation that you are facing? And on that note, I would like to cite a piece of data. 48% of clinics and medical practices stated this to be the best growth opportunity for their businesses in the next 12 months, and this being technology investment. So where does your technology investment stand for the next 12 to 18 months? But before that, if you could tell us about the barriers too.
Yeah, sure. So let me start with the investment first, and then we can go to the barriers.
Sure.
So as I told you that basically our group is headed by Dr. Thumbay Moideen in my opening statement. He has got his two sons, Mr. Akbar Moideen Thumbay and Mr. Akram Moideen Thumbay. Mr. Akbar and Mr. Akram both are in their early 30s. And Mr. Akbar is the Vice President of Healthcare Division, and I report to him. And Mr. Akram basically heads the Thumbay Technologies. So as far as funding is concerned, so fortunately for this group, it's not an issue at all because both are tech savvy. So both basically believe that yes, technology is the way forward. So in that way, alhamdulillah, funding is not an issue for us. And as far as the barriers are concerned, we have been lucky not to face any such resistance, especially from our doctors when we started implementing EMRs, because if you had asked me this question around 20 to 25 years back about the barriers, I would have definitely stated yes. The reason being that when I was a medical student, there were no computers at all. So we started with 386, then 486, then Pentium, then floppies, then pen drives, and so on. So it has moved on. So in last 15 to 20 years, smartphones have really changed the world, and they've made almost everyone whosoever is having a smartphone becomes tech savvy. So what happens is, this implementation of our EMRs we have not faced any issue at all. So there are no barriers as far as I feel. And what has happened is that since our data is integrated and the doctors can see the results, the doctors can see once I say the results, basically the lab results and the radiological results on their screens. So it gives them that sort of an ease. So basically, they have almost become, I can say that, tech friendly, and so we don't face any barriers over here. But yes, it is not barriers, but for everyone, not only for us, but for everyone in the world, the issue is about data security and data privacy, which needs to basically look into.
Absolutely.
We are looking at it all the time, but it's a constant thing that basically needs to move forward.
And very, very sensitive data, that too.
Yeah.
And when you talked about being a medical student 25 to 30 years ago and the lack of technology at that time, it really resonates with me because my father, who's a doctor and 75 years old, he always makes it a point to say that, we did not have technology. We had to sit and chat with our patients for a length of time to understand everything. So, of course, technology has enabled a lot within the healthcare space. Thank you so much, Dr. Walia. And on that note, I would like to move on to you, Khawla. Takalam plans to expand. And not only within the region, you plan to go to Saudi Arabia, of course, but you also have ambition to go into the North American markets with a great intention too, of making counseling more culturally acceptable, more culturally closer to the Arab American diasporic population. Are you facing any technological challenges, are these acting as barriers to your expansion plans? And also, if you could touch upon your future plans over the 12 to 18 months period, how are you opening up conversations around mental health, and how do you plan to keep going at it?
Great, thank you. I mean, for us, we want to be focused initially on two major markets for us, and this is the UAE and the Saudi Arabia. As we think there is high momentum and big support coming from the governments, both governments, focusing on mental health and increasing the community's well-being overall. So this is where our focus is going to be. Meanwhile, things have been growing organically without even trying to actively reach out for individuals from across the world. We currently have users from over 18 countries, and they are scattered in different parts of the world. Now, wherever you are, again, the stigma is still an issue. It's part of us as human to sometimes we unintentionally tend to judge others or get judged and just feel insecure about talking openly about certain topics, and that's including mental health. So the community is there, and when you have access to something that you can relate to, you will more likely go for it. So speaking from a personal experience, I was in these shoes when I was living in the US, and having going through my own personal challenges, all I wanted was to talk to someone I can relate to. And this was not, available. So this is where, the rationale is coming from. And I'm one out of God knows how many individuals who are going through the same. So giving access to cultural understanding, counselors you can relate to, understand your needs, will help a lot of people go easier and go smoother through their challenges, hopefully.
Absolutely. That's really crucial in in the mental health care journey of patients. Thank you so much, Khawla. It's been truly insightful, it's been inspiring, and it's been an engaging conversation with our speakers here today. But before going away, we have to introduce you to our next segment, which is the Expert Speak segment. And today, we have a very well-known medical journalist from the MENA region joining us for this segment just in a few seconds. Welcome Rachel McArthur, a MENA-based medical journalist and also the founder and managing editor of Digital Inc. Media. It's so lovely to have you on the show, Rachel. Thank you so much for joining us. How are you today?
I'm good, thank you. Thanks for having me. And obviously a special hello to William, who had a lot of things to say about the lack of investment in femtech. So nice one, William.
Absolutely. He absolutely cheered me up, really. On that note, Rachel, I'm going to dive right into the questions. And I know that you write extensively about healthcare in the region and beyond. So I will begin with a question on the state of digital transformation that you see within the healthcare sector in the region, specifically the UAE.
Yeah, so I mean, if you look at the state of digital transformation in healthcare, I think you showed some data at the beginning as well, that before 2020 and then in and after 2020, the difference is night and day. In the face of such an unprecedented event, governments and healthcare providers recognize the urgent need for information sharing, collaboration, and rapid system development. Now, we saw governments, medical providers, and even startups fast track the launch of a new service or solution to accommodate rapidly changing healthcare needs. HIMSS, for example, one of the healthcare networks we contribute to, just released its latest digital maturity report. And to sum up sentiment, the acceleration of digital transformation during COVID-19 has given countries an opportunity to assess their maturity as they prepare for a new age of value-based healthcare. And I think I believe the GCC is actually ahead of many territories. Many of the region's governments' strategies include a large focus on digitization, and this is particularly prominent in the United Arab Emirates and Saudi Arabia. In the UAE, health tech and smart healthcare are no longer terms just associated with the startup community, who arguably have more innovative, creative freedom, so to speak. Since the pandemic, local healthcare authorities and private healthcare companies have been leveraging health tech and smart healthcare to promote integrated experiences. Now, just some of the new or improved technology we've seen during the pandemic, and beyond going into 2022 include obviously the COVID-19 tracking and tracing apps, the centralized national vaccine data recording, remote telemedicine solutions, remote monitoring, and more, all of them really dependent on an interoperability and a robust infrastructure.
Absolutely, I couldn't agree more. I mean, I think I heard this pre-COVID so many times that UAE is able to jump so many steps when it comes to digital transformation within any industry. And I think 2020 proved it optimally.
100%.
On that note, my final question to you, Rachel, in your opinion, in the next 12 to 18 months, what do you see as those 3 top tech trends in the healthcare sector?
Okay, so I'm always quite hesitant to name trends because if, just look at all the trends predicted at the end of 2019 and see where that kind of took us, that nobody expected what was going to happen. So based on current progress, if you will, I think, fingers crossed. I mean, we'll see increased interconnectivity. So more of that. We're going to see the beginning of patient healthcare information sharing between providers on a country level. Now, for example, and I'm speaking about the UAE here, up to the present, if you go to a clinic or a hospital, each provider has its own way of recording your health data, but the data isn't shared beyond that one specific brand at the moment. So this means that important pieces of a patient's health history aren't always accessible. Tests need to be repeated when they don't need to be, each time you see a different doctor and so forth. Now, the UAE government has been working towards changing that. You might have heard of Malafi,
Yes.
which is the health information exchange between healthcare providers in Abu Dhabi. The similar one, health information exchange in Dubai, is called Nabta. Now, right now, Riyati, I believe, actually went live. I mean, it's been in progress for a very long time, but Riyati went live at the beginning of this month, which is, it aims to unify medical records from across the Emirates. So it's going to be working with Malafi, with Marbid, etc. And this is going to improve patient care and make services more efficient. So for example, if I'm going to, if I need urgent medical attention in Abu Dhabi, where I'm not based, they can access my data from my hospital, my GP in Dubai. Now, the advantage of a centralized system is that when doctors have instant access to important medical history, they can provide improved, safer, and more efficient care. So it eliminates the need for unnecessary repeat tests and procedures, as I mentioned before. And in an emergency, it's potentially life-saving. So that's, I would say, the first one, connectivity, and we're going to hear more about reality, for example. I have to mention telehealth. That's one that's kind of sped up in recent, the recent 12 months or so. If you look at the projected global market, one recent report forecast growth from 79.79 billion in 2020 to 396.76 billion into 2027. So that's within 7 years. That's phenomenal growth. And if you look at pre-pandemic to post-pandemic, telehealth utilization is about 38 times higher than prior to COVID-19, sorry. Yeah. So we will continue to see government health authorities and private healthcare providers embrace it. And many will also continue to explore a hybrid telemedicine model, which will hopefully improve the quality of communication between doctors and patients. The Internet of Medical Things, also known as IoMT, and wearables for effective remote healthcare will also be key areas, I believe. So, for example, diabetes, rather than the traditional model of you just checking in with the doctor every few months, you could actually be remotely monitored by your healthcare provider, which is more efficient, and you can actually get more care personalized to yourself. The third trend that I'm going to end with would be artificial intelligence. I wish I had regional figures, but I know that the global AI healthcare market size was valued at $6.7 billion in 2020, and it's anticipated to expand at a CAGR of about 41.8% from 2021 to 2028. So it's predicted that AI applications may cut annual US healthcare costs by about $150 billion by 2026, which is, a lot of people kind of don't really know what AI involves and how is it going to automate healthcare, et cetera, but it's used for a lot of things, even just the booking, automatic bookings right now, a lot of it is AI enabled. You've got virtual nurse assistants, for example, for a personalized patient experience, robotic surgical systems to conduct surgical procedures from afar. That there is AI used in that. Even there was something about thermometers that are based on machine learning, so it actually is able to diagnose and predict the treatment. So there's a lot of things happening behind the scenes. Startups, especially as well, looking at some phenomenal just ideas, and it really shows that when you as much as the pandemic obviously was really bad from a human level, but it also showed that when needs must, then people get into action and actually start looking at new ways, which I think was long overdue in the healthcare industry. Absolutely. So those are the ones to look out for. I would say others, maybe the role of technology in value-based healthcare, cloud computing, predictive analysis. But one thing is for certain, is that investment in healthcare technology will continue to be a key priority for the United Arab Emirates and the rest of the GCC.
Wonderful. So it continues to be a hot topic, investment into health tech. Thank you so much, Rachel, for joining us. And these views are fantastic. And just like that, with that, it's a wrap of our first episode of DisruptX, which has been full of learning, sharing, and massive takeaways. So I've been taking down notes, as you all could see, and I am genuinely looking forward to hear our audience's feedback, comments on our LinkedIn page. The handle, as I said, is @DisruptX, and please do use the hashtag #FutureOfHealthTech. Also, this show has been recorded and will be available for viewing and sharing on the DisruptX website. Before leaving, I would like to thank the team that made DisruptX possible, spearheaded by the lovely Upasana Barua, founder of Misonica. Thank you so much. Thank you so much for getting this off the ground. A big thank you to our wonderful speakers for sharing such great insights and our audience for joining us today. Stay tuned for our next episode in January 2022. Wish you all a beautiful and blessed festive season. See you in the new year. Thank you.